Hey everyone, Dr. Mike here. If you've ever noticed a swelling or lump in your neck, you're not alone, and I know it can be a little scary. Many people worry when they find something unusual in this area, but the good news is that most causes are not serious. Today, I want to help you understand what might be going on and what steps you should take next. Let's talk about something that can be alarming: finding a lump or swelling in your neck. It's natural to feel anxious, but remember, not every lump is dangerous. Some are caused by simple infections, while others might be related to your body's normal response to illness. While any new lump should be checked by a healthcare professional, knowing the basics can help ease your mind. Understanding what's normal and what's not can make a big difference in how you approach your health. It's always better to be informed and proactive, rather than worried and unsure. Two of the most common causes of neck swelling are swollen lymph nodes, what we call lymphadenopathy, and thyroiditis, which is inflammation of the thyroid gland. Lymph nodes are small bean-shaped structures that help your body fight infection, and they can swell up when you're sick. The thyroid gland, on the other hand, controls your metabolism and can become inflamed for different reasons. Both conditions can look similar from the outside, but they have different causes, symptoms, and treatments. Swollen lymph nodes often come with a sore throat, fever, or recent cold, while thyroiditis might cause changes in your energy, weight, or even your mood. That's why it's important to pay attention to other symptoms you might be experiencing. Your neck is packed with important structures: lymph nodes, the thyroid gland, blood vessels, nerves, and more. Because of this, swelling in the neck can mean many different things, from a simple infection to something that needs more attention. Sometimes, doctors use tools like ultrasound or blood tests to get a clearer picture of what's happening inside. In this video, we'll break down what each condition is, what causes it, and what you can expect when you visit your doctor. We'll also talk about the questions your doctor might ask and the tests they might recommend to get to the bottom of your symptoms. By the end, you'll know the key differences between common causes of neck swelling, and you'll be ready to talk to your doctor with confidence. Remember, knowledge is power when it comes to your health. Let's get started and take the first step toward understanding what's going on in your neck. Lymphadenopathy is a medical term that refers to the swelling or enlargement of lymph nodes, which are small, bean-shaped structures found throughout your body. These nodes are an essential part of your immune system, acting as filters that help protect you from infections and disease. When you hear someone mention swollen glands, they're usually talking about lymphadenopathy. Lymph nodes are scattered in clusters in areas like your neck, armpits, and groin. They're connected by lymphatic vessels which carry a clear fluid called lymph throughout your body. This fluid contains white blood cells which are crucial for fighting off infections. The main job of lymph nodes is to trap and destroy bacteria, viruses, and abnormal cells. When your body detects an invader, such as a virus or bacteria, the lymph nodes in the affected area often become more active, producing more immune cells to help fight off the threat. As a result, these nodes can swell and become tender to the touch. This swelling is a sign that your immune system is working hard to protect you. It's a normal response to infection or inflammation, and it usually goes away once the underlying problem is resolved. Most commonly, lymphadenopathy is caused by infections such as the common cold, strep throat, or skin infections. These are usually temporary and resolve as your body recovers. However, there are other causes as well. Sometimes, autoimmune diseases, where the immune system mistakenly attacks the body's own tissues, can lead to swollen lymph nodes. Certain medications can also trigger this reaction as a side effect. In rare cases, lymphadenopathy can be a sign of something more serious, such as cancer. Persistent or rapidly growing lymph nodes may indicate conditions like lymphoma or leukemia, which are cancers of the lymphatic system or blood. While swollen lymph nodes are usually a sign that your immune system is doing its job, it's important to pay attention to any lumps that don't go away, grow quickly, or are accompanied by other symptoms like fever, night sweats, or unexplained weight loss. Most causes of lymphadenopathy are harmless and resolve on their own, but if you notice persistent swelling or other concerning symptoms, it's a good idea to see a healthcare professional for evaluation and peace of mind. Next, let's explore how you can recognize the difference between normal and abnormal lymph node swelling, and when it's time to seek medical advice. The main symptom is a lump under the skin, often tender, soft, and movable if due to infection. If the lump is hard, fixed, painless, and growing, it could be more serious. Other clues: fever, sore throat, fatigue, or night sweats. Diagnosis starts with your doctor asking about your symptoms and examining the lump. Blood tests and imaging like ultrasound may follow if the cause isn't clear. Sometimes a biopsy is needed to rule out cancer. The key: pay attention to the lump's features and your overall symptoms. Preventing lymphadenopathy means preventing infections. Wash your hands, get vaccinated, and treat infections early. For chronic conditions, work with your doctor to manage them. Treatment depends on the cause. Viral infections need rest and fluids. Bacterial infections need antibiotics. Autoimmune causes require immune-modulating medications. If cancer is the cause, treatment targets the cancer itself. The focus is always on treating the underlying issue, not just the swelling. Most cases resolve as the root problem is treated. Now, let's talk about thyroiditis, inflammation of the thyroid gland at the base of your neck. The thyroid controls metabolism, heart rate, and energy. The most common type is Hashimoto's thyroiditis, an autoimmune attack on the gland, leading to hypothyroidism. Postpartum thyroiditis can affect women after childbirth, causing temporary hormone swings. Other types include subacute thyroiditis, often after a virus, drug-induced, and rarely, bacterial infection. Thyroiditis can cause the whole gland to swell, goiter, or form nodules. The symptoms and treatment depend on the type and stage. Symptoms depend on hormone levels. Too much hormone, hyperthyroidism, causes anxiety, weight loss, sweating, and palpitations. Too little, hypothyroidism, leads to fatigue, weight gain, feeling cold, and dry skin. The thyroid may feel enlarged or tender. Diagnosis includes a neck exam, blood tests for TSH, and thyroid hormones, and sometimes antibody tests. Ultrasound helps check for nodules or structural changes. A radioactive iodine scan or biopsy may be used if cancer is suspected. The pattern of symptoms and test results guides the diagnosis. Early detection is key for effective management. Preventing thyroiditis is tough since most causes are autoimmune or follow viral illness. Healthy habits, balanced diet, stress management, and regular checkups support your immune system. If you're at risk, know the symptoms and get regular thyroid checks. Treatment depends on the type: symptom control for hyperthyroid phases, hormone replacement for hypothyroidism. Anti-inflammatories or steroids may help with pain and swelling. Bacterial thyroiditis needs antibiotics and sometimes drainage. The goal is to restore hormone balance and address the underlying cause. Let's take a closer look at lymphadenopathy and thyroiditis by comparing them side by side. Understanding the differences between these two conditions is crucial for both patients and healthcare providers, as they can present with similar symptoms but require very different approaches to diagnosis and treatment. Lymphadenopathy refers to swollen lymph nodes, which are small, bean-shaped structures that play a vital role in your immune system. These nodes are usually found in clusters, and when they become enlarged, they often feel like small, movable lumps under the skin. Most commonly, lymphadenopathy appears on the sides of the neck, but it can also occur in other areas such as the armpits or groin. Swelling is often a response to infection, inflammation, or, less commonly, cancer. In contrast, thyroiditis is inflammation of the thyroid gland, which sits at the front and center of your neck. This inflammation can cause a noticeable swelling, often described as a diffuse fullness or a goiter. Unlike lymph nodes, the thyroid is a single organ, and its swelling tends to be more central rather than off to the sides. One key difference is movement during swallowing. Lymph nodes generally do not move when you swallow, while a thyroid swelling will rise and fall with each swallow. This simple test can help distinguish between the two during a physical exam. Symptoms of lymphadenopathy often include pain or tenderness in the affected area, fever, and other signs of infection such as redness or warmth. Sometimes, the underlying cause may be a viral or bacterial infection, and the lymph nodes react by swelling as they filter out harmful agents. Thyroiditis, on the other hand, is more likely to cause symptoms related to hormone imbalance. Patients may experience fatigue, unexplained weight changes, anxiety, irritability, or feeling unusually cold or hot. These symptoms occur because the inflamed thyroid may produce too much or too little hormone, affecting the body's metabolism. Diagnosing lymphadenopathy typically involves a thorough physical exam, blood tests to look for infection or inflammation, and imaging studies like ultrasound or CT scans. In some cases, if the cause is unclear or cancer is suspected, a biopsy of the lymph node may be necessary. For thyroiditis, diagnosis also starts with a physical exam, but blood tests focus on thyroid hormone levels and specific antibodies that indicate autoimmune thyroid disease. Ultrasound imaging helps assess the size and texture of the thyroid gland, and sometimes a fine needle aspiration is performed to rule out other conditions. Treatment for lymphadenopathy depends on the underlying cause. If it's due to a bacterial infection, antibiotics may be prescribed. If inflammation is the culprit, anti-inflammatory medications can help. In rare cases where cancer is found, more advanced treatments like chemotherapy or surgery may be needed. Managing thyroiditis focuses on controlling symptoms, replacing missing hormones with medication if needed, and reducing inflammation. Some cases resolve on their own, while others require long-term hormone therapy or additional treatments to manage autoimmune activity. In summary, both lymphadenopathy and thyroiditis can cause neck lumps, but their causes, symptoms, and treatments are quite different. Persistent or unexplained neck swelling always deserves medical evaluation to ensure the right diagnosis and care. Remember, swollen lymph nodes usually mean your immune system is fighting something, while an inflamed thyroid points to a hormone issue. Knowing the difference can help you and your doctor take the right next steps. In summary, neck lumps are common and usually not dangerous, but they always deserve attention. Lymphadenopathy is often your immune system fighting infection. Thyroiditis is a problem with hormone production. The symptoms, causes, and treatments are different, so knowing the basics helps you communicate with your doctor. Don't ignore a new or persistent lump. Get it checked. Diagnosis is stepwise and logical, starting with a simple exam. Early evaluation leads to better outcomes, whether it's a minor infection or a chronic condition. Stay informed, listen to your body, and be proactive about your health. Thanks for watching. Stay healthy.